Class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park. That is in Pooler, Georgia. We're in Suite 404 of Building 400. If you'd like to stop in to the office, that would be wonderful, but I would suggest that you call ahead. Best way to reach me would be to call my cell phone directly at area code 845-561-2225. Again, 845-561-2225. Again, that is my cell phone. I will be the one answering that phone if I'm not in with somebody or helping somebody at the moment. Please do not text that phone, as that phone is not equipped to receive texts. I will not get them. You will not get a response, and that would kind of defeat the purpose of you trying to reach out to me. But you can email me, which is similar to texting, at docrick@spineboy.com. That's DOCRICK at spineboy.com. And it's my pleasure to help you to better understanding with the concerns that you have. We've been doing these video classes each week since the beginning of the year as a result of the current circumstances in the world related to COVID-19. This particular class is on vitamin M, which is usually referred to as folic acid. It's a lot of information, covers a lot of ground. I'm not going to try to remember all of it off the top of my head in an effort to do this video justice. So I'm actually going to read some things to you with some comments in between. And please bear with me. So folic acid is known as folate, folate, vitamin M, and pterylglutamic, I guess. Folic acid is water-soluble vitamin. Takes its name from the foliage, as it is first found in dark leafy green vegetables. Unfortunately, folic acid is destroyed by high temperatures in cooking with acids such as vinegar. This vitamin is also decreased when stored for long periods of time at room temperature or when exposed to light. A large percentage of this vitamin is also lost in cooking water. So, appreciating that light and heat and boiling this vitamin destroys it. It is a B vitamin. They are water soluble, and they are light sensitive and heat sensitive. So cooking your food, boiling your food, microwaving your food is going to create a problem and cause you to lose your folic acid. It says, unfortunately, folic acid is destroyed by high temperatures in cooking with acids such as vinegar. The body does not produce folic acid, but the liver converts it to folinic acid with the assistance of vitamin C, and can then store it. So you need adequate amounts of vitamin C in order to store it. Another heat-sensitive and light-sensitive vitamin. Sources of folic acid are found in foods such as eggs, fish, green leafy vegetables, peas, and avocado. Other significant food sources of folic acid are nuts, organ meats, wheat germ, asparagus, and the ever-favorite liver. Don't eat liver. I personally don't. Okay. Folic acid in pregnancy. Folic acid is very important for all women who may become pregnant. Adequate folate intake during the periconception period, or the period around getting pregnant, time just before and after a woman becomes pregnant, helps protect against a number of congenital malformations, including neural tube defects, meaning spinal cord defects. Neural tube defects result in malformations of the spine, known as spina bifida, within the skull or within the brain, known as anencephaly. The risk of neural tube defects is significantly reduced when supplemental folic acid is consumed in addition to a healthy diet prior to and during the first months following conception. Women who would become pregnant are advised to eat foods high in folic acid, or take supplements in addition to eating folate-rich foods to reduce the risk of some serious birth defects. Taking 400 micrograms of whole food supplement has been suggested. The recommended daily allowance for folate equivalents for pregnant women is 600 micrograms, twice that of the normal recommended 300 micrograms for those who are not interested in getting pregnant. Folic acid supplementation and masking of B12 deficiency. This I find interesting. Okay. There have been concerns about the interaction between vitamin B12 and folic acid. Folic acid supplements can correct the anemia associated with vitamin B12 deficiency. Unfortunately, folic acid will not correct changes in the nervous system that result from vitamin B12 deficiency. Permanent nerve damage could theoretically occur if vitamin B12 deficiency is not treated. Therefore, intake of supplemental folic acid should not exceed 1,000 micrograms, or 1 milligram, per day to prevent folic acid from masking symptoms of vitamin B12 deficiency. However, one recent study has demonstrated that high folic or folate levels when combined with low B12 levels are associated with significant cognitive impairment among the elderly. We certainly don't want that for our elder generation, as we're all going to become old at some point. If the observed relationship for seniors between folic acid intake, B12 levels, and cognitive impairment is replicated and confirmed, this is likely to reopen the debate for folic acid fortification within food. While public health policies tend generally to support the developmental needs for infants and children over slight risk to other population groups, the ratio of benefits in this case is likely to be on the scale of one child's life saved versus impairment of hundreds or thousands of seniors. We shouldn't treat our elders that way. Like I said, we're all going to become elders at some point. In any case, it's important for older adults to be aware of the relationship between folic acid and vitamin B12 because they are at greater risk of having vitamin B12 deficiency. If you are 50 years of age or older, I'm in that category, ask your physician to check your B12 status before you take supplements that contain folic acid. We have a supplement here in the office that supplies the correct balance of folic acid and vitamin B12. It's actually called folic acid B12 of all things. So, health risks of too much folic acid. The risk of toxicity from folic acid is quite low. The Institute of Medicine has established a tolerable upper intake level of folate for 1 milligram for adult men and women, and an upper limit of 800 micrograms for pregnant and lactating or breastfeeding women less than 18 years of age. Supplemental folic acid should not exceed the upper limit to prevent folic acid from masking symptoms of vitamin B12 deficiency. Again, we have the supplement that will solve both problems in the proper ratios called folic acid B12. Dietary fortification of folic acid. These are some current issues and controversial issues about folate. Since the discovery of the link between insufficient folic acid and neural tube defects, governments and health organizations worldwide have made recommendations concerning folic acid supplementation for women intending to become pregnant. For example, the United States Public Health Service recommends an extra 0.4 milligrams per day, which can be taken in a pill. However, many researchers believe that supplementation in this way can never work effectively enough since about half of all pregnancies in the U.S. are unplanned, and not all women will comply with the recommendations. Interesting. If you're interested in having a child, do whatever you have to do in order to have a healthy child. Investing for 9 to 12 months to have a healthy child is worth anything that would occur if you didn't take the precautions and now had to deal with some level of deficiency or handicap within your child. So please take the time to be properly prepared if you choose to start a family or continue to add to your family. And as you get older, your deficiencies get bigger. So you're going to want to probably practice consuming high quality folic acid B12 for a longer period of time than you would if you were younger. So this has led to the introduction of many countries of fortification where synthetic artificial folic acid, not that I recommend that, is added to the flour with the intention of everyone benefiting from the associated rise in blood folate levels. This is not uncontroversial, with issues having been raised concerning individual liberty and the masking the effects of synthetic folate fortification on vitamin B12 deficiency or pernicious anemia. However, most North and South American countries now fortify their flour, along with a number of Middle Eastern countries and Indonesia. Mongolia and a number of ex-Soviet republics are among these having widespread voluntary fortification. About 5 more countries, including Morocco, the first African country, have agreed but not yet implemented fortification. In the UK, the Food Standards Agency has recommended fortification. To date, no EU country has yet fortified. Australia is considering fortification, but a period of comments attracted strong opposition from industry as well as academia. In the United States, many grains produced are fortified with synthetic folic acid. This, unfortunately, will not help you as much as they or you think you might be helped from adding artificial folic acid. Number of years back, basically 25 years ago, the United States Food and Drug Administration published regulations requiring the addition of synthetic folic acid to enrich bread, cereals, flours, cornmeal, pastas, rice, and other grain products. This ruling took effect January 1st of 1998 and was specifically targeted to reduce the risks of neural tube defects in newborns. There are concerns that the amount of folic acid is insufficient. In October of 2006, that's 15 years ago, the Australian press claimed the United States regulation requiring fortification of grain products were being interpreted as disallowing fortification in non-grain products, specifically Vegemite, an Australian yeast extract containing folate. The FDA later said the report was inaccurate and no ban or other action was taken against Vegemite. Since the folic acid fortification process took effect, fortified foods have become a major source of folic acid in the American diet. The Center for Disease Control and Prevention in Atlanta, Georgia, used data from 23 birth defect registries to cover about half the United States births and extrapolated their findings to the rest of the country. The data indicated that since the addition of synthetic folic acid in grain-based foods as mandated by the Food and Drug Administration, the rate of neural tube defects dropped 25% in the United States. Can you imagine what would happen if the FDA actually started using real food-based folic acid or folic acid B12 that we use in the office here? Although folic acid does not reduce the risk of birth defects, it is only one part of the picture and should not be considered a cure. Even women taking daily synthetic folic acid supplements have been known to have children with neural tube defects. Again, this is why we recommend Standard Process's whole food folic acid B12 supplementation. It contains all the natural folic acid and B12 that nature would want you to have in the ratios that nature would want you to have it. So folic acid is actually associated with heart disease. Adequate concentrations of folate, vitamin B12, and vitamin B6 may decrease the circulating levels of a thing called homocysteine, an amino acid normally found in the blood. There is evidence that elevated homocysteine levels is an independent risk factor for heart disease or stroke. The evidence suggests that high levels of homocysteine may damage coronary arteries and make it easier for blood clotting cells called platelets to clump together to form a clot. However, there is currently no evidence available to suggest that lowering homocysteine with vitamins will reduce your risk of coronary heart disease. Clinical intervention trials are needed to determine whether supplementation with normal folic acid, vitamin B12, and/or vitamin B6 can lower your risk of developing coronary artery disease. The Norvit trial suggests that synthetic folic acid supplementation may do more harm than good. It's because it's synthetic. It's not made by God. It's not natural. Synthetics are not good to consume. Real food, real whole food supplementations, those are healthy. Again, this is why we recommend the whole food supplement folic acid B12 from Standard Process. It is 100% food-based and nothing added, thus allowing your body to do what it should do in the presence of folic acid and vitamin B12. As of 2006, or 15 years ago, Studies have shown that giving synthetic folic acid to reduce levels of homocysteine did not result in clinical benefits. One of these studies suggested that synthetic folate in combination with synthetic B12 may actually increase some cardiovascular risks. It's because they're going to deplete your body of the natural stores that it has when you put in synthetics. This is because the artificial or synthetic vitamins do not contain all the activating cofactors and enzymes necessary to activate normal metabolic processes. Standard processed supplements made from whole foods without the introduction of heat during manufacturing allows for everything nature would want you to have in the ratios that nature would want you to have it, thus allowing your body to do what it was intended to do. Folic acid appears to reduce the risks of stroke if it's real folic acid. Folic acid and cancer. Some evidence associated with low blood levels of folate with a greater risk of cancer. Folate is involved in the synthesis, repair, and functioning of DNA, our genetic map, and a deficiency of folate may result in damage to the DNA, which may lead to cancer. Several studies have associated diets low in folate with increased risk of breast, pancreatic, and colon cancer. Findings from the studies of over 121,000 nurses suggest that long-term folic acid supplementation, meaning for at least 15 years, was associated with a decreased risk of colon cancer in women 55 to 69 years of age. That's encouraging. Folate intake counteracts breast cancer risks associated with alcohol consumption, and women who drink alcohol and have high folate intake are not at increased risk of cancer. And appreciate that high consumptions of alcohol depletes your B vitamins. Wonder if there's a link there. Of course there is. Those who have high 200 micrograms or more per day levels of folate in their diet are not at an increased risk of breast cancer compared to those who abstain from alcohol. However, associations between diet and disease do not indicate a direct cause. This is because the understanding of cause and effect is grossly misrepresented in an effort to create products that can be patented and sold for profit. Researchers are continuing to investigate whether enhanced folate intake from foods or if natural folic acid supplements may reduce the risk of cancer. Folate is important for cells and tissues that rapidly divide. Cancer cells divide rapidly, and drugs that interfere with folate metabolism are used to treat cancer. Methotrexate is a drug often used to treat cancer because it inhibits the production of the active form tetrahydrofolate. Unfortunately, methotrexate can be toxic, producing side effects such as inflammation in the digestive tract and may make it difficult to eat normally. This also hinders the body's ability to absorb food for the purposes of healing, assuming that you're actually eating real food or taking real supplements, whole food supplements. Folinic acid is a form of folate that can help rescue or reserve the toxic effects of methotrexate. Folinic acid is not the same as folic acid. Synthetic folic acid supplements have little established role in cancer chemotherapy. There have been cases of severe adverse effects of accidental substitution of synthetic folic acid for folinic acid in patients receiving methotrexate cancer chemotherapy. It is important for anyone receiving methotrexate to follow medical advice on the use of folic or folinic acid supplements. Folic acid and methotrexate for non-cancerous disease. Low-dose methotrexate is used to treat a wide variety of non-cancerous diseases such as rheumatoid arthritis, lupus erythematosus, psoriasis, asthma, sarcoidosis, primary biliary cirrhosis, or inflammatory bowel disease. Low doses of methotrexate can deplete folate stores and cause side effects that are similar to folate deficiency. Both high folate diets and natural supplementation of folic acid may help reduce the toxic side effects of low-dose methotrexate without decreasing its effectiveness. That's good to know. Anyone taking low-dose methotrexate for the health problems that we listed above should consult with physicians about the need for natural folic acid supplementations. Again, this is rheumatoid arthritis, lupus erythematosus, or SLE, psoriasis, asthma, sarcoidosis, primary biliary cirrhosis, and inflammatory bowel disease. Now, there are actually some associations with folic acid and depression. Some evidence links low levels of folate with depression. There is some limited evidence from randomized controlled trials that using natural folic acid in addition to antidepressant medication may have benefits. Researchers at the University of York and Hull, York Medical School, have confirmed a link between depression and low levels of folate in research studies involving 15,315 people. However, the evidence is probably too limited at present for this to be a routine treatment recommendation. I say you should get on more research to figure if that's helpful. Memory and mental agility. In a 3-year trial on 818 people over the age of 50, short-term memory, mental agility, and verbal fluency were all found to be better among people who took 800 micrograms of folic acid daily, twice the recommended daily allowance than those who took placebo. The study was reported in Lancet back in January of 2007. Fertility. Folate is necessary for fertility in both men and women. In men, it contributes to spermatogenesis, or the production of sperm. In women, on the other hand, it contributes to oocyte maturation, implantation, placentation, and in addition to general effects of folic acid in pregnancy. Therefore, it's necessary to receive sufficient amounts throughout the diet in order to support subfertility. So what you need to consider. It's been a lot of information. My apologies. If you suspect you might be having a deficiency in folic acid, also known as vitamin M, and want to find out, stop into the office. We'll be happy to test you for it. If you are currently taking folic acid supplementation, bring that with you, and we can determine together whether that actually supports you or does not support you. And if it doesn't support you, we will get you the real thing made from whole foods called folic acid B12. So that's it for this week's show. It's quite a lengthy show. I apologize for reading so much, but I wanted to get you the accurate information so that you could get the benefit of having the information. I'm going to ask you to stop into the office at 138 Canal Street in Pooler Park. That is in Pooler, Georgia, Suite 404 of Building 400. Call me directly at area code 845-561-2225. Or email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. Stop into our website, spineboy.com, and do some research within the website. It's designed for you to help you, and I would look forward to supporting you next week when your health matters. Thanks again.